Hey Health Junkies, Dr. Krause here. Just wanted to jump in and let you know about a new feature that I'm adding to the podcast. It's the ability to ask me questions. I've had a ton of folks tell me that they would love for me to cover their questions on the podcast, so I'm going to do it. So each week I will be adding a couple of questions that I'm going to answer to each of the podcasts. And if it's a juicy enough question, I just may dedicate a whole podcast to it. So if you're interested in asking a question, head on over to my website at drjkrausend.com. Check out a blue button on the right-hand side that says Ask a Podcast Question. Hit me up there. Or you can also access the button through my podcast notes, also on my website. So head on over there, ask me some questions. I look forward to answering them soon. All right, let's get on with the podcast.
Hey, Health Junkies! It's time for The Health Fix. Join your host, Dr. Janine Krause, as she gives you a dose of what you need to know and do right now to take control of your health from the inside out, to rebel against aging, look damn good, fight stress, and laugh every day.
Hello there, Health Junkies. Welcome to another episode of The Health Fix. I'm your host, Dr. Janine Krause. And today's episode is all about sun and heat, how it boosts the mood and improves mobility. So yes, I had a podcast a couple weeks ago where I talked about going to the Cayman Islands and getting all warm and how good that felt. But I didn't go into the details of what warmth really does for your skin and perhaps why some of these spa therapies, so the red light therapy, massage, gua sha, cupping, all of those different things actually work to help with mobility, but also can help with mood. So what I've been finding is that there are a lot of folks out there talking about cryotherapy and the importance of getting, exposed to cold temperatures. But I can't help but think that we've got some folks that would do great with that and the connection with boosting your immunity by shocking the system with cold. But unfortunately, in my practice, what I'm seeing a lot of is that the average body temperature in a lot of folks who have what I call a sick tissue is actually a lot lower than what the agreed upon body temperature should be. So what the heck am I saying? Well, body temperature is supposed to be 37 degrees Celsius or 98.6 Fahrenheit. That's kind of what we learned as textbook body temperature. However, I found that a lot of people run 97, 97.1, 97.3 in terms of their temperature, which is a heck of a lot different than 98. I mean, yes, it's at 1 degree of temperature, but I'm finding that people are cold. I touch their hands and feet and they're cold. I touch their leg and their skin's cold. And then, of course, one of the main complaints is chronic pain and cellulite and just not feeling good. Now, I mentioned in a previous podcast of mine, the one I was talking about the Cayman Islands, is that really I feel the best when I'm laying in sun. I mean, cats do it, dogs do it. Humans like to sunbathe. There's a lot of research in terms of what the sun does for us. And I will give you some details today as to what that warmth does and why perhaps things such as massage, things such as gua sha, so scraping of the skin, actually help to improve circulation, because we're creating an irritant which brings blood flow to that area, but we're also warming up the tissue. Massage is a warming type of therapy. Plus, also you go into a room to get a massage and hopefully your massage therapist has a heated table, because that's also another component of this. And of course, as an acupuncturist, I also have heated tables. It's just one of those things. You just do that because it feels good. I don't think any of my patients really complain. Maybe I have a few, but very rarely do I get complaints that my tables don't feel good when you slide in on a cold day. So let's think about this in terms of where I'm headed, because I've been talking about fascial tissue the last two podcasts, and this podcast is a continuation of that. And what I've been talking about is what we know as a term of sick tissue. And sick tissue is skin that feels crunchy. That's lost its elasticity. So the collagen has broken down, the elastin's broken down, and now it's like hard and crunchy kind of tissue. And that kind of tissue doesn't move very well. Or if it's on your face, it sags and you've got a lot of fine lines and wrinkles. Now, I see hand in hand cold temperature folks going along with circulation issues. So why would we have circulation issues? Well, yes, we're getting some blood flow to our tissues if our skin is still alive. I mean, if you're still alive, your skin's pretty much going to be still alive unless you've got some major stuff going on. But circulation in general, a lot of folks, it could be related to poor diet. I'm shocked how many people are anemic. So lacking iron carries oxygen to your tissues. It's like shocking how many people are anemic, but yet they're overfed, so they're overweight, but somehow they're not getting their nutrients because they're not eating what they should be, or they're not able to absorb the nutrients that they need to. Now, I have a lot of folks too that struggle with temperature regulation. And by that I mean they're always cold or they get hot too easily. And all of these types of conditions are precursors to autoimmune disease. And yes, I've made a big jump there and a big generalization, but if we have sick tissue, meaning that we can't detoxify our skin, it doesn't move well, then we've got a lot of things to think about as in terms of why. And fibromyalgia, so fibromyalgia being a chronic pain condition, is sick tissue at its worst case. And I see a lot of folks who have Hashimoto's, which is an autoimmune type of condition for the thyroid, where their body is actively attacking their thyroid tissue, but also it starts to attack their muscle, not muscle really, but kind of the tissue around the muscle. So your fascial tissue, like I've been mentioning with this whole podcast. But what happens is we're not getting blood flow to the fascial tissue like we should. And then we end up with hard, non-mobile loss of elasticity. And really that's what's happening. When I say tissue damage, we're losing the collagen and elastins. Maybe because someone ate too many sugars, like I mentioned in my last podcast, where they bind to the proteins and make the tissue brittle, but it could be other things too. Now, another thing that I'm seeing over and over again in my practice is that we have folks that have temperature regulation issues because they're stressed out. And temperature regulation as a foundation occurs in your hypothalamus. This is a message center in the center of your brain. And there's something called the hypothalamic pituitary axis. And this axis connects in with your hypothalamus in your brain that communicates with your pituitary. That's also this little tiny gland in your brain that also communicates with your thyroid. It communicates with your adrenals. It communicates with a lot of different areas in the body. And the more stressed someone becomes, what I found is that temperature regulation starts to become off. The more that someone has thyroid issues, the more that temperature regulation starts to become a problem. I see more and more thyroid issues happening every single day in my practice. It's like everybody has it, and it's scary. Something's up here. And usually I'm not looking at hyperthyroidism. I'm looking, for the most part, at folks with hypo, so under-functioning thyroids. Your thyroid is in charge of creating hormones that work on helping with circulation in your peripheral tissue, so your skin. And so huge connection with really cold hands and feet and thyroid conditions. Another thing that seems to be on the rise is Raynaud's. Raynaud's is a type of condition, and there's Raynaud's disease, and there's Raynaud's syndrome. But what it is difficulty with regulating blood flow in the hands and feet, and in particular the hands. And you'll see the hands go completely white on these folks, or they'll go purple in very cold temperatures. And so they struggle to deal with cold temperatures. So just something that I want to put out there, there's these types of conditions. Now, an interesting component that I think about when I think about how we can benefit from warmer temperatures and warming of our skin and tissues is when I look at the Chinese medicine diagnoses for tissue issues. So in Chinese medicine, we look at all issues in the body as being either a deficiency or an excess of something. Now, the Chinese believe that wind could get into your tissue and your joints and cause pain. Could also cause emotional conditions too. They believe that cold in an excess, or you can have a deficiency of cold, which would be more of like something called a yin deficiency, because yin is your cooling, yang is your warming energy. Now you could have an excess of damp. Damp is something that the Chinese believe occurs when we do not absorb nutrients properly and we build up fluids. And diabetes is a damp type of condition. Poor digestion is a damp condition. But damp can make us cold in the Chinese universe. Environments that are damp, such as the Pacific Northwest, can make us cold. And so these types of cold and damp and wind block our energy flow. And anything that blocks energy flow can cause pain. Now, the Chinese also believe that there's heat that can cause issues as well. So this is excess of heat. So we're back to this everything in moderation component. The Chinese also believe that blood deficiency and qi deficiency can cause pain and stagnation, so issues in terms of blood movement. One of the common diagnoses that I see in the Chinese world is something called heart blood deficiency or liver blood deficiency. So these are conditions in which someone's not making or not absorbing enough of the nutrients to be able to utilize them to have healthy tissues. Also, a digestive deficiency would be same in this case, and oftentimes spleen qi deficiency. So spleen is a digestive deficiency to the Chinese, and spleen damp, meaning overaccumulation of food. If you eat too much on a regular basis or you eat too many cold raw foods, you can have a condition that's considered damp. What I've found over and over again is that I see folks who eat a raw foods diet or like are hitting up the salads like crazy, tend to feel cold internally a lot. This is a circulation problem, and it goes back to the basics in terms of we need warm food to help us to digest food best. So something to think about just while I'm talking through this podcast in terms of why heat is good for us. Now, of course, I'm going to geek out on what's happening on the cellular level too, so stay tuned. I'm going to get into that. But the most interesting thing to me in terms of taking account in the Chinese world is that temperatures and weather terms like wind and dampness and hot and cold are taken into account that as a contributor to our issues. And so if someone is cold all the time, it makes sense to warm them up. And there's foods like ginger and cayenne that warm these folks up, but there's also habits, environment. Oftentimes we think about the snowbirds, folks who move from, say, well, I grew up in Illinois, so I'm going to use Illinois for an example. A lot of people will live in Illinois, but then go to Arizona or Florida for the summer. Or sorry, not for the summer, they go for the winter. They're snowbirds. And it's because they feel better when they're in a warmer environment. Think about yourself. Do you feel better when you're in a warmer environment? I always do. I always have. And if you look at my constitution as a Chinese medicine practitioner, I am very damped. My condition is spleen yang deficiency, meaning I don't have a lot of fire to help my digestive system to break apart food, but I also have a weak digestive system that is causing that as well. And then I build up damp, meaning I don't break down food well, so things accumulate, which is a very simplified version of it. But the reality is a lot of us just need warmth on a regular basis to help us to regulate our circulation. And we might have less pain, we might have a better mood if we work on these things. So that's me just kind of giving you a little breakdown here. Plus, one of the things to keep in mind is that perhaps if we keep exposing ourselves to cold environments, we might be actually interfering with our body's way to heal itself. Like, for example, a lot of people have foot pain but cold feet, and they walk around their houses with no socks on. In the Chinese world, it's like mind-blowing as to why you wouldn't wear socks or slippers. But in US, it's common, and I'll fully admit that I'm one of these people that I like to be barefoot, but my feet are often freezing cold. So I'm being more mindful in this case. But another thing is that I see a lot of folks who are cold that also tend to underdress. They wear what's in style, but not what's comfortable and keeping them warm. Sometimes I'll find that folks have shirts that slide up and their back's exposed, and then they have back pain. Well, if you're not keeping your back warm, you can't keep it mobile because you're not getting that much circulation to it. So something to keep in mind right now. Another thing that is interesting to me is that a lot of people have a buildup of cellulite. And when you touch that tissue, it's often cold. What does that mean? The body kind of forgot about that area. It saw it as excess stored stuff there and said, meh, whatever. So what's happening here? What's happening to society? Why do we have a bunch of people with low temperatures, like below the 98.6 on a regular basis? What is going on? I don't know. Is it environment? Is it diet? Is it a combination of these things? Is it stress? Maybe. The Chinese believe that if we have poor circulation, sometimes it could be due to something called liver qi stagnation, meaning blood's not moving properly in the body. And the answer to that is to give them ginseng, which is warming, dan kuai, which is an herb that is also a blood-moving herb. Ginger is another common one, especially if there's deficiency or issues with the digestive system. So the Chinese knew this years and years and years ago, but why can't we seem to get our crap together here in the modern day? Now, another thing that I see all the time is that I use heat to reduce muscle tension. And most people, that's a no-brainer. We do that. But we don't think of it on a daily basis as to how much heat is important for us to just really remove the tension from those tight muscles so that we can free up joint mobility. Because muscle is attached to bone. And anytime those muscles are pulling on the bone, it's going to hurt. And particularly, they attach near joints. And if you have one muscle that's super tight that's pulling on a joint, you better believe that joint above and below it is also going to be locked up. So loosening up your muscles and loosening up the skin and their connections by freeing up the mobility of your joints goes a long way for you to feel better, but also to just have an overall sense of well-being. And why do I say an overall sense of well-being? Well, to move and to feel where we are in space, our body has to have our proprioceptive nerves. So these are our nerves that tell us where we are in space. Those nerves need to be active. If they are restricted because they're not able to sense anything because we have a bunch of non-mobile tissue that has damaged collagen and elastin around it because it's got a bunch of sugar molecules bound to it, and so it's all brittle and non-mobile. Well, now the only nerves left to sense where we are and what's going on are our nociceptors, which are pain nerves. But oddly enough, heat nerves, so temperature sensing nerves in particular, travel with our nociceptors. So you can work on quieting your pain nerves when you heat them up. Same kind of thing goes when you numb them out by making them cold. But the problem with cold, now I'm all for ice when it is an acute injury. Absolutely part of the key acute injury treatment. But when you have a chronic pain issue, if you're putting ice on that area, you are causing some trouble. You're not allowing blood flow to get to tissue that needs blood flow more than anything. And particularly your tendons and ligaments, they don't have a lot of natural blood flow. You got to stimulate that blood flow to them. And that's what heat does. That's what manual therapy, such as gua sha, cupping, massage, that helps to get heat and blood flow. And with blood flow comes healing proteins and all of the nutrients, oxygen, things of that nature to help heal up that tissue. If you keep putting ice on somewhere that hurts, it's not help. The reason you feel better with ice is because you're numbing the nerves. That's what you're doing. Now, if you have a tendonitis type of condition, there is some merit to using a little bit of cold. And the way I do it is 3 minutes hot, 30 seconds cold. Alternate 3 times, end on the cold. What am I doing here? It's like a radiator flush for that particular aching area. And that's absolutely great if you have tendonitis, because tendonitis is a really inflamed area. However, if you have chronic pain that's not of tendonitis nature, no one can figure out why you have pain in that area, it's probably a mobility issue, and you need to figure out what you need to do to get that area moving better so that you can get to a quality PT who can watch you move and figure out what your weaknesses are. So you can strengthen those so that your body's not in compensation mode all the freaking time. So there's that. Now I have an interesting point for you just to kind of drive it home about being warm and how our bodies like the warmth. Your taste buds have serotonin receptors in them, just like your skin. And I'm going to talk about the serotonin receptors in the skin here in a second. But your taste buds have serotonin receptors. And we know serotonin being the neurochemical that makes us feel good. Now, interestingly enough, this could be why warm foods feel good over cold foods, especially on cold days. So in the Chinese medicine model, like I've mentioned before, warm food's always a good way to promote good digestion and good mood. So if your taste buds have serotonin receptors like your skin and can be activated by warmth just like your skin, why wouldn't you like warm things? Much better than ice cold foods all the time into the system. Now, I'm not saying that you should never have ice cream. I'm not saying that you should never ever have cold drinks. I'm just putting it out there that in times when it's cold out, it might be better to go for the warmth versus times that it's warm out naturally. Because if it's warm out naturally, think about a nice warm summer day, which it's nice and sunny. You feel better. I don't care who you are. You could be depressed as all get up, but you're going to feel slightly better on a warm, sunny day. I'll take anyone who wants to challenge me on that. But if it's a cold, cloudy day and you try to eat salad, that doesn't really do anything for food, for your nutrition and your soul. Because keep in mind, your taste buds have serotonin receptors and they get activated by warmth because your serotonin receptors are in your skin. And we've found that the serotonin system in your skin is capable of being activated by melanin. So sun going to your skin, but also warm temperatures. So am I saying tan your tongue? No, I'm just saying that warm foods, there's a point there in terms of how warm foods are really great comfort foods, but they also can help to boost mood. And there you have it. So let's move on to mood and tissue so I can get to some background here. So like I was saying, our skin has a serotonergic system. So we can produce serotonin in our skin. And the reason that we came up with this idea that we can do that is we found that there is the enzyme tryptophan hydroxylase in our skin. And that is the precursor enzyme. So it's an enzyme necessary for making serotonin. And we've also found that our keratinocytes, so these are cells in our skin, have serotonin transporters in them, which is pretty cool. And so it leads to the concept that, okay, if we can produce serotonin in our skin, then we can feel happy when we stimulate that skin. And how do you stimulate your skin? Well, your skin can be stimulated by touch, but it could also be stimulated by sunlight and stimulation of melanin receptors, because melanin is what builds up and makes us tan. It's our natural sun protection, if you think of it that way. Folks who are darker in color have more built-in sun protection than us folks who are lighter in color. So, interesting concept here for you to just kind of take this one step further is that your brain and your epidermis, so epidermis is your most superficial layer of your outer skin, were developed from the same embryological tissue. And so when I'm saying embryological, I'm saying when you're a little embryo inside mom and you're developing, your cells that create your brain are the same cells that create your skin. So it would make sense that your skin and your brain have some similar components, similar elements. And so we go from there in terms of thinking that our serotonin synergist, I can't talk. The serotonergic system, maybe it could be a remnant of our evolution, but we have the components there that suggest that we can produce serotonin in response to touch, in response to warmth, and in response to sun. So, stimulation, sun, warmth. 3 key components. as to why humans might really love sunbathing. Now, this all then begs the question, is our fight or flight system rooted in our skin too? Because we do have adrenal reactions, so this is our fight or flight adrenaline reaction in our skin. We can also have this sixth sense sometimes in terms of if someone's behind you or right around the corner. You know what I'm talking about. When you're in a room and you're like, oh, someone's standing in the doorway. You turn around, boom, there they are. Or it's kind of like that feeling you get when you're going into a room where news is about to be delivered and everyone's in a crabby mood. You can feel that energy. It's a visceral type of reaction. So you can feel it inside, but you can also feel it in your skin. So something to think about in terms of the fight or flight response. Naturally, in the mode of fight or flight, usually we're going to put our blood flow into our muscles so that we can escape from a bear or whatever may be running after us. And we're also going to pre-cool, which means we're going to sweat. But what I found is that a lot of people that have sick tissue, so their skin doesn't work so well, doesn't move so well, don't sweat. And maybe you've heard the research say that those who sweat are more physically fit, or those who sweat are more healthy, or things of that nature. Well, you need to sweat to detoxify. So if you're not sweating, you're not detoxifying properly. So I would say those who sweat are a little bit healthier for sure. Now, physically fit, I don't know, because I am not a great sweater. And I would say that I'm decently physically fit. I'm no, Olympic athlete by any means, but I find it interesting that some folks sweat and some folks don't. And those who are more prone to not sweating. So I have some patients that don't sweat at all. Now this is an issue. And they get sick when they try to work out and things of that nature. So what is the component there? I don't know. Then we have some patients in my practice who sweat all the time and who are in fight or flight mode all the time, and they're constantly pitting out and their hands are sweaty, but yet they feel cold. I don't know. Something's up here. So just wanting to put that out there. I don't have answers to this. I'm going to dive in more at some point, but right now I'm just using this as a thought basis, just to kind of put the thoughts out there. I'd love to hear from you folks what you think. I would love to see comments about these podcasts, because I think part of the reason, I know part of the reason why I like to do this podcast is because I want to hear what other folks think about in terms of their reactions and in terms of what their hunches are about health and where we're headed. All right, so let's talk about light, for example, because we want to talk about the warmth component of sunlight. So light influences the binding of serotonin at a particular receptor called the 1A receptor site, so HT1A. And the more light, the more serotonin binding. The less light, less serotonin binding. And the binding potential of serotonin definitely changes with the season because it's related to the average duration of daily sunshine. Now, I have seen direct connection, and there's tons of articles on this, where people's mood tanks when we start to have darkness at 4:30 in the afternoon and the sun doesn't rise until 7:30 a.m. The shorter the day, the more depression, and could be quite possibly due to this binding potential of serotonin related to light. Now, another interesting component here is that serotonin can bind to platelets. So it's like going right through your bloodstream, and plasma levels and concentrations of serotonin in their metabolites decrease in the winter. So this is why serotonin is a huge component in terms, it is a component in terms of mood, but it's also a huge component in terms of seasonal affective disorder. A lot of folks say, oh, it doesn't really exist. I'm sorry. I see it day in, day out. My patients, I can see a person's mood change over the course of a year and in terms of the seasons. I'm a huge proponent in my practice of making sure that patients take vacations every January, February, somewhere in that January, February, March range. You gotta go away and get some sun, because here in the Pacific Northwest, it gets real. Like, it is dark a lot and you don't see the sun sometimes. Sometimes it's like we've had streaks for like 30 plus days. That's crazy. That does a lot of crazy stuff to your brain. And you can't take enough vitamin D to deal with that. I'm sorry. You need your happy light and you need a vacay. And if you can't afford a vacay, then happy light. Happy light and warmth and touch. So let's talk about this warm touch and what it does. Because there's a lot of naysayers out there in terms of saying that fascial work doesn't really do anything for the emotions. It doesn't really do anything for helping with mood. Well, I call BS on that because you feel good after a massage because endorphins are getting released because you're warm in there and your tissue's increasing in temperature. There's straight up research that shows if you get your skin temperature up to 107, that's like the top out. There's no reason for you, I mean, we'll talk about that here in a minute, but topping out in terms of effectiveness from heat is 107 degrees Fahrenheit or 42 degrees Celsius. But between 80 and 100 degrees, so 80 and 107 degrees Fahrenheit, if you're exposed to those temperatures, you boost serotonin. So 80 degrees Fahrenheit to 107 degrees Fahrenheit, or 27 degrees Celsius to 42 degrees Celsius. This is the effective range of heat therapy for serotonin boosting. So you might be thinking like, okay, 80 degrees, I mean, that's really warm for my house. If I keep it at that, I'm going to be broke. Well, yeah, I agree. So what do? You insulate, you cover yourself better. You put your socks on, you put your slippers on. You get yourself a heat lamp, or you get yourself a heating pad or one of those microwavable ones, and you put it on your belly, because if you warm your belly, you can warm the rest of your body pretty good. Or you can warm whatever hurts. You can warm your feet. I found that if you warm people's feet, honestly, belly or feet, if you warm the belly or feet, you can warm the whole body up. It's crazy. I kid you not. Try it out if you want to know how it works. One of my most favorite ways actually to warm the whole body is to take river stones and put them in between the toes. So warm river stones between the toes. It feels like this rush of heat all the way up your body. It's the craziest thing ever, but I'm telling you, awesome treatment. I had someone do that to me once at a spa after I ran one of my marathons in like sleet and cold weather, and I was freezing. And this massage therapist was gonna do a hot stone massage on me, which she did do, but she put the stones in between all my toes. It was the coolest thing ever, and now it's like, boom. I love doing that. So, point being, one of the best ways to boost your mood and your warmth and your circulation between 80 and 107 degrees Fahrenheit or 27 to 42 Celsius if you are a Celsius person. So, let's go back to this for a second. Agreed upon normal body temperatures between 37 degrees Celsius and, not between, it is 37 degrees Celsius or 98.6 Fahrenheit. But like I said before, I don't see people much out of the 97s. A lot of people, 97.1, 97.3, 97. Oh, I mean, it's crazy in terms of nobody's really at 98.6 anymore. Very rarely. Most of the time it's like 98.2 even, 98 on the dot. So we're getting colder, but why? What are we doing to ourselves that keeps this? And I find that consistently, the colder the temperature, the more pain someone has. The colder the temperature, body temperature overall, their feet and hands are cold too. So poor circulation. So like I mentioned before, I keep massage tables warm. Now granted, in the middle of the summer, I don't do this, but most of the time in the winter, those tables are on. Even into some of the summer, I will admit that I do have it on low levels. But we can also, we don't have to have warm massage tables at our houses. We can warm up ourselves by doing massage, gua sha, cupping. These all elicit a response in our body. One, because it's an irritation, right? Because someone's pressing on you. They're pulling, they're manipulating your muscle, or they're scraping your superficial skin, or they're using a cup to suction your tissue. And what it's doing is it's eliciting a response to the brain from your proprioceptive receptors, because they're like, whoa, wait, something's happening. My tissue's moving. Now it's also going to stimulate your temperature receptors, and your pain receptors are in there too, and they might get elicited a little bit too, because cupping can elicit a little pain. So can massage. deep tissue in particular, and so can gua sha, the scraping technique, or graston, if you're familiar with the physical therapy technique. It's the same thing. But the point being here is all of these different modalities help increase motion, they help increase mobility, so they reduce pain, but they also increase serotonin levels and increase your mood. So, and they're increasing, all while increasing your temperature. Now, Bikram yoga, for example, hot yoga, 105 degrees or 40.5 Celsius. That's kind of the standard in terms of temperature for this type of yoga. A lot of people walk out of there feeling amazing. Other people don't feel so great. It's usually the folks that don't sweat so well or sweat too much. My fight or flight stressed out folks, not doing so well with the hot yoga. So something to keep in mind while you're working with warming your body up. If you are extremely stressed out, if you're having trouble dealing with stress and you're pretty emotional at this point because you're just, your system's fried, you've pushed yourself to the limits and you're unstable, going to hot yoga is probably not the best thing for you. I would recommend getting a heat pack and working on warming up your feet, warming up your belly first before you try to jump into something like hot yoga. I've had way too many of my patients, especially those with fibromyalgia and things of that nature, that have jumped into hot yoga and totally passed out and just not felt good. It is beneficial. Now, I don't recommend hot yoga every single day. I only think 2 to 3 times a week max would be good for you in terms of looking at trying to work on mobility and warming the body in that case. Now, I'm going to get geeky with you a little bit for a second. So let's talk about temperature related to blood flow in your body. So resting blood flow is 0.25 liters a minute. So that's like your basic blood flow. And that's what we call it in a thermoneutral environment. So this is when you're not being heated. It's just you're maintaining your 97 or 98.6 or wherever you flow in terms of your temperature. Now, check this out. You can increase your blood flow to 6 to 8 liters a minute in severe hyperthermia. So this is like when you really warm yourself up. And this is kind of the case in which if you've ever been to hot springs or a hot tub that was too hot and you stayed in there for too long, or a sauna, that's when you've got your blood flow cranking. You don't want to do that to yourself. Public service announcement. I'm not talking about cranking your heat up so high that you're going to get dizzy and you're going to pass out. I'm talking about just keeping yourself a little bit warmer than your average body temperature. Remember, like I said, between 80 and 107, you'll get effect. 107 is where you top out. Now, a lot of hot springs and hot tubs are over 110 in terms of the temperature. Even a lot of the infrared saunas are 111 in terms of temperature on the low end, and they go up to 140 in terms of high end. Now, obviously, your environment's that temperature, not you. But the longer you're in there, the more you're creeping towards that temperature. So the idea here is paying attention to how you feel and just being very, very conscious of how long you expose yourself to these warming things. Same thing with being out in the sun too, because you can get sunstroke really quickly. So what I have folks keeping in mind is maybe we consider warmth in terms of segments of time. I am all for saunas, infrared saunas, 10, 15 minutes, 20 at the most, 30 minutes at the extreme most, but keeping the temperature on the lowest level. Now, in terms of heating packs, 20 minutes with direct contact to the skin, red light therapy, infrared therapy, 6 to 8 inches away from the skin, sure, you can hang out there 10, 15 minutes. But the idea here is you got to be careful with what you're doing here, because yeah, you very well could go beyond threshold here. Now, what I'm saying in terms of if you want to just feel this out is warm enough to feel good, but if your skin's starting to turn red because of a heat lamp or infrared, if it's really starting to turn red and it's getting bright red and it's starting to feel somewhat uncomfortable, that's when you got to quit. And so, read the devices, the guidelines on the devices that you're using to warm you up if you're going to be using a sauna or a red light therapy device, and make sure that you keep in mind the distance, so 6 to 8 inches for the infrared and red light therapies, and in saunas it's time, how long you're in there. Now, if you're worried about exposure to all of those things and how long you're out and whatnot, one of the other things that I highly recommend is get a massage, go exercise. All of these things also increase heat in the body. If you get your body temperature up with exercising, you are going to help with your mood. You're going to help with your mobility and blood circulation. It's a big deal. It's good. You're also going to be increasing something called nitric oxide. Nitric oxide is an amazing thing. Not to be confused with nitrous oxide. This is nitric oxide. This is created from the amino acid arginine. And protein-rich foods like meat and poultry can help you to get this. However, a lot of folks can't absorb their proteins very well. A lot of us are protein malnourished, which sounds weird because a lot of folks are eating the protein, they're just not absorbing it. I see arginine being a low amino acid on folks when I test folks using the Nutri-Eval over and over again. So that's a big deal, just something to keep in mind. Now, plant foods, beets, leafy greens like kale, chard, arugula, spinach, those guys are all rich in dietary nitrates. And you might be thinking, oh, nitrates, that's bad. I don't want that because that was toxic in my processed meats. Yes, if it's added synthetically to bacon and sausages. But when it comes naturally in your plant foods, it's okay. You actually need it to help you to form nitric oxide, which is a natural vasodilator. An example of the concept of using nitric oxide is nitroglycerin. That is like a little pill you put under your tongue if you have chest pain due to constricted chest vessels. So it's a commonly used pharmaceutical medication for folks that have angina, so chest pain. But in the regular world, nitric oxide helps us to increase blood flow to our tissues via vasodilation. So it dilates your blood vessels, helps you with circulation. So eating your beets and leafy greens helps you. So Popeye was not far off. Keep you strong, you need your greens. Beets, there are a lot of proponents out there of beet juice. Now, I like the fiber, so I like folks to cook their beets a little bit and blend it up that way and get the fiber out of it. Plus, beets are easier digested when they're a little cooked. I'll be honest, because raw beets are hard for some folks to digest. So keep that in mind that some folks will have stomach pain from raw beets. Cooked beets might be a better option for you. There's a Dr. Whitaker out there. He proposes that you have 1 to 2 cups of beet juice a day to help with your nitric oxide load and helping to increase circulation in the body. I think that's an awesome idea also for anybody who's anemic and struggling to get oxygen to their tissues. Really great idea if you are headed to environments like high altitude environments. Great concept when you get there to help with oxygenation. Amazing stuff. And to keep it going, if you are, say, living in somewhere like Breckenridge, Colorado, and you want to go run a marathon down in Denver or in Chicago and you want to kick some serious butt, keep your beets and dark leafy greens going. Yeah, little tidbits there. All right, so where am I at in terms of heat applications? Because I was talking a little bit about making sure that you're keeping things in check and keeping things safe. You can really cause some damage, like I said before, if you are keeping the heat on you for too long. So just making sure that if you're doing a local heat application, 20 minutes if it's like a heating pad, and check, look at your skin. Is it getting too red? And what by that, I mean like if it's pink, fine. But if you're starting to get like straight up red, like bright red, you better take that thing off and let your skin cool back down. In terms of massage, in terms of gua sha, those things are not going to heat you up too high, too fast. It's going to heat you up just enough to get blood flow going and get mobility. Safe tools here. Whereas direct heat, sometimes you can be you got to be careful. The number one reason acupuncturists get sued is because our lamps can burn you. And it's too close to the skin for too long. It's got to be 6 to 8 inches away if you're going to warm someone up with that. And it can do amazing things, but we don't want to leave it too close to the skin for too long. So like I said before, if you've got a heat lamp, or you've got an infrared, or you've got, for example, a heating pad, just be careful and no longer than 20 minutes with that. So just random notes, just in case you want to know, because I don't know why I feel this need to give you all of the public service announcements on heat. But one of the things that's kind of crazy is prolonged exposure of skin to 43 degrees Celsius or 109 or higher for a prolonged period of time could lead to blister formation. So be careful. That's my point. I don't want anyone to listen to this podcast, go heat themselves up like to oblivion, and then not be happy. I want you to be safe. All right. So what does all this tell us? So we know that there are ways to obtain sunlight and mimic the effects of sunlight if we don't live in a sunny area or don't have the funds to take regular sunny vacations. But if you do have the funds, Arizona's pretty cheap. Vegas is always cheap. You can get there, get the sun, and get out within a weekend. So just saying. You can increase your mobility with heat. You can reduce pain and boost mood with heat. Being warm makes you happy. I can tell you it over and over again, but just think about how the summer seems to make things better overall. Or just one sunny day can make the world a difference. Or just think about your last vacation in the sun and how you felt. I don't probably need to say more at that point. Now, emotions can be stored in the skin and tissues and joints. If you go back to my podcast with Nicole Connolly London, I talk all about it. But if we talk about emotions being stored in our skin, our tissue, and joints, could it be that lack of blood flow due to lack of heat caused serotonin receptors to not be stimulated properly? So then they don't produce enough serotonin on the regular, and now we've got reduced mobility in the joints, and we're not producing serotonin. But when you open up the mobility and you get a massage going in that area and you warm up that area, perhaps the increase in serotonin going there gets an emotional response. I'm not sure. I just want to post it out there for you guys to think about there. It's kind of like my deep thoughts. So, what do you think? Do you think that emotional releases connected to massage, or when you're working on increasing mobility in a certain area, could very well be related to a stimulation of serotonin in that area? A lot of people tell me they feel great after massage, and sometimes they'll say like, yeah, I felt a little emotional and then it passed through. It's kind of weird. It's a little woo-woo. There's some naysayers that say, oh, there's no way that you could get an emotional release from massage, but I'm sorry. I feel freaking great after massage, so I think the serotonin got boosted. But thinking about that, just post in the comments if you've ever had an emotional release happen while getting a massage, or what kind of great things came out of a massage for you. So just something to think about. Another thing to think about, and where my next podcast is going, is I have a fascination with the itch sensation. And the reason being is because I have a lot of patients in my practice too that have chronic itching, and we can't seem to get to the bottom of it. But there's an interesting component in terms of serotonin playing a role in inhibiting pain, but making itch worse. Like, for example, opiate medications can suppress pain, but they increase itch. So, what is that about? So my next podcast is going to be all about the physiology of itch and what is going on with the connection with serotonin there, and the fight or flight response that's also included in the itch, along with histamine reactions. So I'm going to go into a little bit more detail as to why those things happen and what I'm trying to help folks with to get that itch in check. So in the meantime, if you are struggling with being cold, having cold hands or feet, reduced mobility, chronic pain, one of the things you can do is get your socks on. Make sure that you're not going barefooted. Make sure that you have clothes that cover your neck, your low back. You're staying warm. You're not letting yourself get cold. You're eating whole foods, closest to nature foods. I'm always going to say that. But warm foods, especially in colder temperatures. You're eating iron-rich foods like beet soups, dark leafy greens. And if you're gonna do it raw, at least drink warm tea with it to help to increase that serotonin response on your tongue so that you can get your digestive system going better, because so 95% of your serotonin is in your gut. So keep that in mind. Now, exercise. Got to get your blood moving, but also warm your body up with exercise. The more increase in temperature you have, the more you're going to feel better, and you're going to feel that blood moving better. Now, sauna, red light therapy, one of my favorite things to consider too, to help with artificial light, because unfortunately we can't all get on those vacations all the time. Massage, self-tissue work like the gua sha, the cupping, working on mobility work. Awesome stuff. Clearing out your sick tissues. I recommend a 21-day detox by the company called Standard Process. They've got a cool program. If you're not into 21 days of detoxing, there's another company called Emless. They have a 7-day detox that's pretty great. But I'm all about trying to clear your body out so that you can make it work optimally. Because a lot of us are bogged down. We have sick tissues, we have sick guts because we eat junk and we stay stressed and we don't deal with it. So I am here to try to help you in that case. And that's why I'm doing this podcast. I want to have a healthier generation. I want people to take charge and take care of themselves and really think about what's happening in your body and know that there are things you can do naturally. You do not have to resort to medications all the time to take care of yourself. And you don't have to resort to copious amounts of supplements either. There are manual therapies like massage and gua sha and cupping and eating right and eating the right temperature foods. Simple things that can go a long way for you. So I have put my notes into my resource page on my website at drjkrausend.com so that you can learn how to restore your circulation and invoke the effects of the sun without even having to go on a sunny vacay, and also how all of that subsequently helps to improve mood. So there you have it. That is my way to help with improving circulation and boosting mood, all while relieving pain, which I highly recommend you check out because there's so many easy ways to work on combating this. We do not have to resort to copious amounts of supplements or medications to do it. So you have survived another episode of The Health Fix. I'm your host, Dr. Janine Kraus. Have a great day, whatever you're doing. Thanks for tuning into The Health Fix, the podcast all about taking control of your health, rebelling against aging, and having fun every day. A lot of patients ask me, do you think I'm aging too fast? So, I created an evaluation checklist for you to see for yourself. Plus, I created a resource guide to help you slow down the aging process right now. You can find it for free on my website, drjkrausend.com. If you like this podcast, help get the word out to others by liking it and rating it. If you'd like more natural health tips and want to join our Facebook community where I interact daily, click on the Join Group button on our website at drjkrausend.com.